This is a case on physician-assisted suicide, Gonzalez versus Oregon. My name is Lauren Rogdy, and this is for my ethics and healthcare class. The case was brought to the U.S. Supreme Court in October of 2005 and was ruled in 2006. So it only took 3 months for the Supreme Court to decide this case, which is quite fast if you ask me. We have to think about the stakeholders. What do they have to lose? The physicians, their reputation as a healer in society. We go to physicians to heal us. We don't go to physicians to end our life. The Attorney General argued that physicians were, that PAS was an illegitimate practice, and they were on the grounds of possibly losing their license. That goes for pharmacists as well. Patients, unfortunately, if they do lose this case, the relief of pain and suffering and the right to death with dignity is huge here. If this does not pass, they don't get that. And then we have to talk about the U.S. Attorney General. He is the people's lawyer. We expect him to do what's best for us. While he doesn't delegate everything in our life, physician-assisted suicide would be so beneficial to terminally ill patients. So if he doesn't pass this, there's a lot of respect to lose. People might think that he's going against us. So the most important issues in the case, who has the power? Is it the Attorney General? Is it the state? Is physician-assisted suicide ethical? Is it not ethical? There's a lot more important issues. These are the most important. Who has the power and whether or not this is ethical or not. The significance of the topic. Since 1998, and this number only goes until 2017, but 4,249 prescriptions were written. That is a lot of prescriptions. That's a lot of people wanting to end their life, reasonably so. Again, these are terminally ill patients, so it's a criteria of 6 months to live that have requested this medication, and 66.3% have taken the medication to hasten their death. So then we're talking about the significance again, the cost of palliative care versus hospice care versus beneficent. So if we go ahead with palliative and hospice care, when we're looking at beneficence, if we're keeping these patients alive, how much harm are we actually bringing onto them by keeping them alive? Beneficence, we have to act in the best interest of the patient. We can also tie in non-maleficence here. So definitely some significant issues to talk about. And then the end of life concerns. A lot of people are worried about losing just some of the things that people who aren't sick take for granted. Being able to take care of yourself, being able to do things on your own, walking, talking, feeding yourself, those kinds of things. So this is a definite, significant issue. And that's why a lot of these people, the concerns bring them to physician-assisted suicide. So my thesis statement reads, although a physician's duty is to do no harm, physician-assisted suicide should be every person's human right because the act permits self-determination and liberates those who are terminally ill from a dreadful death. I stand by this statement throughout my entire paper. I believe it is truly up to the people, the terminally ill, to decide whether or not they want to hasten their death. And yeah, I firmly believe this. So there's a lot of ethical principles in conflict with this case, with just physician-assisted suicide as a whole. The two that I talked about were autonomy versus non-maleficence. I also tied in beneficence, as I discussed a few slides earlier. So autonomy, the self-determination of life, they should get to choose whether or not they want to end their life. And then it's the cessation of pain and prolonged suffering. Again, these people aren't Joe Schmo walking down the street. These are people who are suffering. They are in pain. They have 6 months to live. And they should be the ones to determine whether or not they want to end their life. Then we have non-maleficence. So a physician should never do harm onto a patient, and we understand that. That's their job. However, when you talk about autonomy as well, by not doing any harm and not allowing them to end their life, how much suffering are we creating because of that? How much more pain are we putting them through? So then we also have to talk about the patient-physician relationship. And we also have to talk about the physician's reputation within society. They're the healers. They're not supposed to bring death unto people. You also have some religious arguments. The Christian faith says that God should be the determining factor of death, not medication, not physicians, no one but God. So this was a really fun argument to talk about. It's a tough one to break up, but autonomy, non-maleficence. Are we going to side with the patient, or are we going to side with the fact of don't do any harm onto the patient? That's not what physicians are supposed to do. While there are lots of laws, codes, and duties, these are the 4 that I focused on in my paper. You have the Code of Medical Ethics, which breaks down what a physician, it kind of guides a physician as to what's ethical, what isn't ethical, just as a member of the medical profession. You have the Oregon Death with Dignity Act. This specific paper kind of breaks down the requirements a patient must obtain in order to request that prescription. You have the Controlled Substance Act, which was the Attorney General's biggest argument, and it's just a federal statute that regulates the manufacture and distribution of controlled substances, such as like narcotics, depressants, and stimulants. And then I talked about the 10th Amendment, which states the powers not delegated to the United States by the Constitution, nor prohibited by it to the states, are reserved to the states respectively, or to the people. So all of these laws, the codes, and the duties, these were all used in my case, and there were a lot of good arguments with these codes and duties and laws to back up the arguments of the 2 sides. My favorite part. The U.S. Supreme Court ruled in favor of Oregon, saying that they could have their own physician-assisted suicide laws. They said that the Attorney General's rule was invalid, that he can only regulate registration and control. I thought this was an awesome decision. I loved it. I think patients should have that autonomy. They should be the ones to decide their life. So yeah, I totally agreed with this. I loved the outcome. Yeah, round of applause for Oregon. So solutions for the future, I think physician-assisted suicide should be legalized across all states. It reduces people having to move across country to end their life. It reduces the end-of-life anxiety. However, I do think that there should be more physician opinions. Currently, there's only 2 that are needed to decide whether or not a patient is terminally ill, and mandatory examination by a psychiatrist, regardless of whether or not the patient is depressed, should also be included. So here's the thing, the conclusion, right? Physicians aren't acting out of their realm, out of their jurisdiction by providing these medications to the patients who are terminally ill, who just want to die with dignity. And the U.S. Supreme Court determined that. This case was and is a case precedent for the 7 other states who passed physician-assisted suicide laws. It really is up to the patient to determine when they want to die, and it's not up to the federal government. We have to think about autonomy, what the patient wants. There's a lot of laws and codes that provide that for the patients. This was a wonderful case. I learned a lot. I hope you did as well. If you want to learn more, Google it. If you disagree with me, I highly suggest that you Google it. Thank you so much for listening to my presentation. I hope you have a wonderful day.